everyone, welcome back to our channel. My name is Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So today's video is going to be another foundational type of video. In a few videos we will get to more practical tips, but we do feel like there are, a few more key important things that we want to discuss to really set you up with a good foundation of understanding, okay? So in today's video we will be discussing the 3Ds, dementia, delirium, and depression. And just a heads up, I might get tongue-tied because of all these D's, but just bear with me, okay? So some of you may be wondering, what is the difference and why is it important? Okay, why do we need to distinguish between the 3Ds? Well, for one, it's important to recognize that not all changes in behavior, changes in mood, or confusion equals dementia, right? So it may signify that something is wrong, but that wrong might not necessarily mean dementia. Does that make sense? So it's important to know these different signs and symptoms because if you notice them, you do want to get your partner to the doctor for further medical assessment because some of them are treatable, and so if they are, that's good, right? But some of them are not. And that's also important to know because then it gives you an idea of what your next steps need to be, okay? So the first D that we're going to discuss is depression. So depression is a biological-based illness that affects your thoughts, your mood, your behavior, your feelings, and even your physical state of well-being. And the main difference between depression and, say, delirium or dementia is that there's going to be this prolonged state of 2 weeks or more where the person is experiencing this low mood, disinterest in once enjoyable things, and this overall sense of hopelessness. And so some of the things that you may notice are changes in memory, changes in concentration, changes in thinking, changes in self-esteem, okay? And so you may hear them speaking more negative. They may talk about death or suicide. They may say, I don't want to be here anymore. They may start sleeping a lot, so you may notice changes in their sleep patterns. You may notice changes in their appetites, okay? But the key distinguishing factor is that there is this prolonged state of 2 weeks or more, it could be even months, where they're in this overall low mood most days, okay? So all day, every day kind of thing, right? Where they're just depressed, okay? Now, the good thing about depression, especially if it's caught early on, is that it is treatable, okay? So that's important to know. The second D that we're going to discuss is delirium. So with delirium, there is going to be this acute or sudden onset of mental confusion. So one moment they're fine, and the next not so much. One day they're fine, the next not so much. And so some of the things that you may notice is increasing confusion, increasing agitation, maybe more nonsensical talk, disorganized thoughts, maybe onset of hallucinations, maybe they're sleeping more and they're sleeping so deep that they're difficult to arouse. Things that were easy for them yesterday are now all of a sudden hard and don't really make much sense to them. Sometimes they can kind of go into this dazed state that's just not normal, right? And so what's important to know about delirium is that it's actually considered a medical emergency. Why? Because it could indicate fever or infection, withdrawals, medication side effects, hypoxia, vitamin deficiencies, a number of things. Other things that can cause delirium are anesthesia, so delirium is pretty common after, say, surgeries, alcohol or drug abuse, and severe mental illness, okay? So if you notice that one day your partner's fine and the next day they're acting kind of off, it could mean that they're in this kind of delirious state, and it could mean that there's something underlying going on. So that's why it's considered a medical emergency, because you really do need to get your person to the doctor and get them assessed and checked out to determine what might be causing this change in state. Now, like I said in the beginning, a person can have more than one D, so it's not uncommon for someone with dementia to also experience delirium. So if you notice that one day your partner's acting as they usually do, but then the next day they're more agitated, or they're sleeping a lot, or they're dazing off, or there's just something different and not typical of them, you really want to get them to the doctor for further medical assessment and intervention, okay? Because a lot of times it's indicative of a UTI. And even if it's not, it's still important to get them to the doctor so you can figure out what's going on, because delirium in most cases are treatable. Delirium's treatable. So if it's something like an infection, they can get antibiotics, right? And it's not something that you want to sit and wait and see if it passes, because if it is an infection, you risk sepsis. And if you're not familiar with sepsis, sepsis is this widespread of infection that can result in organ failure, which is what we don't want. So again, if you notice these symptoms, please, please, please get your loved one, get your partner, get your person to the doctor. Lastly, we have dementia. Now with dementia, the way that it differs from delirium or depression is, unfortunately, it's not treatable or reversible. And it's not going to have this like more recognizable, discernible like onset. Okay, it's not going to be like that. It's going to be more gradual, it's going to be progressive, it's going to worsen over time. Now, if you watched one of our last videos, What is Dementia?, we did mention that there are 5 FDA-approved drugs, but they're more to manage some of the symptoms with dementia, like some of the issues with memory and attention and thinking and things like that. But unfortunately, it's not curable, it's not reversible, and it is going to get worse over time. Now, you may notice some overlapping symptoms. So you may notice, like I said, the memory changes, the thinking changes, the attention deficits, maybe some withdrawal from the environment, from people around them, difficulty in communicating, writing, reading, things like that. But it's going to be over time. It's not going to be this sudden onset. Mom is not going to one day be fine and the next day seem like a completely different person, okay? And if mom does seem like a completely different person the next day, you want to get her to the doctor, because it could be indicative of something underlying that needs to be dealt with, okay? So what is the biggest thing that I want you guys to take away? What I want you to take away is that early detection and early diagnosis is everything. Because like I said, when it comes to delirium and depression, they're treatable. They can be reversed in most cases if you can catch it early on. Now, dementia, unfortunately, is not curable. It's not reversible. It is going to get worse over time, but it's important to know. If you never take your person in to get assessed, you never know, okay? And once you do know, it allows you to know what your next step should be. Okay, so that is why being able to know the signs and symptoms of depression versus delirium versus dementia is so important, because you want to take action so that your person can get the proper care that they need, okay? So that's all that I have for you guys in this video. I am going to leave a link in the description box below of this chart that compares the 3 Ds, so that you can use it for reference if you so choose. Also, don't forget all of our social media links as well as our website is in the description box below. And I will see you guys in the next video.